This transfer is recommended for a patient who can bear weight on both legs, is cooperative and predictable, and can take small steps. It is recommended that a mechanical lift be used if any of these criteria are not met. A transfer belt and 2 trained caregivers are required for this procedure. Explain the procedure to the patient. Ensure that the brakes are applied on the bed and wheelchair. Ensure that the patient's feet are flat on the ground with her hips higher than her knees. Also ensure that the patient's knees are over her toes. Place a transfer belt around the patient and ensure that the buckle is in the front of the patient. If using a transfer belt with handles, ensure that the correct size belt is used so that the handles are easily accessible at the size of the patient. If the transfer belt does not have handles or the handles are positioned too far back on the patient, hold on to the belt along the sides of the patient instead. The other caregiver stands on the opposite side of the bed and holds onto the shoulders of the patient to stabilize her. Make sure the transfer belt is fairly snug. You should be able to fit approximately 2 finger widths between the belt and the patient. If the patient has one leg weaker than the other, place the wheelchair on the patient's strong side. The chair should be placed as close as possible to the bed, while leaving enough room for one of the caregivers to move in between the chair and the bed during the transfer if required. Stand directly in front of the patient with your feet staggered forward and back and with your weight on your front leg. Your knees should be bent with your trunk as upright as possible. The other caregiver should stand directly behind the wheelchair and should ensure that it is correctly positioned with the brakes applied. This caregiver may also assist with monitoring the patient's lines, tubes, or catheter during the transfer. Hold the handles on the belt with your elbows slightly bent. Ensure that the patient's arms are on the inside of your arms. The patient may place her arms around your waist for an added sense of security. Ask the patient to lean forward slightly so that her weight is shifted forward slightly. If possible, get the patient to shift her hips forward on the bed so that her knees are over her toes. Ask the patient to assist by pushing with her legs and with her hands against the bed if possible. If the bed has a split side rail, the rail toward the head of the bed may be left up so that the patient may assist by pushing against the side rail. If the patient were to assist by pushing with her hands against the bed or side rail, it may require that the patient's arms are on the outside of the caregiver's arms. Do not allow the patient to place her arms around your neck during the transfer for safety reasons. Perform the transfer by shifting your weight from your front leg to your rear leg while keeping your trunk as upright as possible and elbows tucked in by your sides. Your arms should remain slightly bent throughout this movement. The movement should be a gentle pulling motion and not a lifting motion. Avoid lifting the patient. Ask the patient to take a few steps in a standing position prior to moving toward the wheelchair to ensure that she is steady on her feet. If the patient is unsteady on her feet, she may be safely lowered back to the bed. A mechanical lift should then be used to transfer the patient. During the turn, stand as close as possible to the patient. Ask the patient to slowly turn and back up until the back of her knees are touching the chair. Place one leg back so that your feet are staggered forward and back with your weight on your rear leg and your knees bent. Your forward foot should be placed to the outside of the patient's feet and you should be facing the patient directly. The other caregiver ensures that the wheelchair is correctly positioned. Slowly lower the patient into the chair by shifting your weight from your rear leg to your front leg while at the same time bending your knees. Your elbows should be slightly bent with your trunk upright. Bend your knees more as you lower the patient to prevent forward back bending. Ensure that the patient is seated comfortably. As an alternative, a 2-person transfer may be performed, similar to the standing step-around transfer for a mildly aggressive patient. The caregivers should face one another during this transfer and perform a side-to-side weight shift. Rather than grasping the patient's wrist as described in that procedure, the caregivers may hold onto the hands of the patient for added support and a sense of security. In summary, this procedure is to be used to transfer a patient who can bear weight on both legs, is cooperative and predictable, and can take small steps. It is recommended that a mechanical lift be used if any of these criteria are not met.